MIPS quality reporting used to skip behavioral health. Now your psychologists, social workers, and NPs are eligible professionals, and a complex point system decides whether you get rewarded or penalized. Under MIPS, a 4-category point system determines the financial reward or penalty a provider receives. Meaningful use, promoting interoperability, and MIPS, explained for behavioral health operators, owners, and billers. We walk through meaningful use, promoting interoperability, the umbrella MIPS program, and why MACRA changed who has to report. Meaningful use historically refers to the HITECH Act of 2009, a CMS incentive program to get clinicians to adopt and meaningfully use electronic health records. HITECH defined what meaningful use of EHRs should look like, built around 5 tenets or priorities for clinical care. To get individual clinicians to adopt EHRs, the Centers for Medicare and Medicaid Services created what amounts to an awards program to incentivize adoption. Meaningful use was achieved in a 3-stage process, rolled out over several years. Phase 1, in 2011, focused on getting clinicians to invest in an EHR and begin capturing patient data electronically. Phase 2, in 2014, focused on sharing captured data with relevant parties in keeping with HIPAA requirements. Phase 3, in 2016, focused on improving outcomes through expanded EHR use and care coordination. Meaningful use applied to only a few kinds of clinicians. MIPS applies to a broad range, and many of them now work in addiction treatment. Doctors, clinical psychologists, dietitians, social workers, and nurse practitioners are all eligible professionals obligated to participate under MIPS. Because many more addiction treatment organizations now retain clinicians like these, MIPS reaches behavioral health far more than meaningful use ever did. 1. MIPS category turns on whether a clinician is meaningfully using a qualifying EHR. Behave Health is an all-in-one EHR designed to support that electronic capture directly. Behave Health puts clinical, administration, admissions, treatment plans, and billing in one app, designed to support meaningful electronic use of the record. It is built specifically for addiction treatment settings, where awareness of promoting interoperability is now rising fast. 3 ideas connect the old meaningful use program to the MIPS rules your clinicians report under today. Let us walk through what interoperability means, what MIPS is, and the law that created it. First, in healthcare, interoperability usually means promoting interoperability. Promoting interoperability is a newer CMS program establishing a set of EHR standards for how systems share information. It continues the work meaningful use started, carrying forward the push for electronic records and care coordination. Second, promoting interoperability sits inside a larger compliance program called MIPS. MIPS, the Merit-Based Incentive Program, is overseen by the Centers for Medicare and Medicaid Services. A complex point system spans 4 categories to determine the financial reward or penalty a provider receives. 1 category is whether you are meaningfully using a qualifying EHR. Third, both programs trace back to a single law. MIPS and promoting interoperability were established in 2017 following the Medicare Access and CHIP Reauthorization Act of 2015, known as MACRA. MACRA is the reason the eligible professional list expanded and why behavioral health clinicians now fall under quality reporting. Here is how the old program and the current one differ for behavioral health. Under meaningful use, most SUD providers were not eligible professionals. Medical doctors in non-hospital settings made up the bulk of those impacted. Under MIPS, a far broader set of clinicians is obligated to participate, pulling many addiction treatment organizations into scope. The result is a higher degree of awareness of promoting interoperability in the behavioral health community than there ever was with meaningful use. Behave Health is an all-in-one EHR built for addiction treatment, designed to support the electronic record that MIPS rewards. Clinical notes, administration, admissions, alumni, residents, treatment plans, billing, and insurance authorizations live in one app. It is designed for the evidence-based, results-focused programs now coming into scope under MIPS and promoting interoperability. Behave Health can also help point you to resources for licensing or accreditation per the Joint Commission or CARF. Stop guessing whether MIPS quality reporting reaches your clinicians. Book a 20-minute demo of Behave Health's all-in-one EHR at behavehealth.com. See the all-in-one EHR built for addiction treatment at behavehealth.com.